Now we come to the diet in PCOS. What food should I add to my PCOS diet? High fiber foods can combat insulin resistance by slowing down digestion and reducing the effect of sugar on the blood. This may be beneficial for PCOS patients. Vegetables like broccoli, cauliflower, sprouts, beans and lentils, green vegetables, green and red pepper, sweet potatoes, pumpkins, etc. are good for PCOS. And at the same time, you have to drink plenty of water. Lean protein like chicken and fish do not provide fiber but are very good filling and nutritious diet for PCOS patients. Food that help reduce inflammation may also be beneficial. These are the tomatoes, the spinach, almonds and walnuts, olive oils, fruits like blueberries and strawberries, fatty fish which are high in omega-3 fatty acids like salmons, hilsa, etc. The PCOS food pyramid is here for your ready reference, and this shows which are the diets you can regularly take and which are the diets you have to avoid. The diet which you have to regularly take are in the base, and of course those which you have to avoid are in the apex of the pyramid. And in between there are proteins and fats, fruits and vegetables, and carbohydrates in a restricted fashion. Foods to avoid in PCOS. These foods like pasta, noodles, pizza, burgers, which are high in calorie and low in fiber, should be avoided. Sugar, which should be limited on a PCOS diet, and of course the fried food. On a PCOS diet, reduce the consumption of beverages like soda and juice, which can be high in sugar as well as inflammatory, and also the foods like fries, margarines, red or processed meats should be avoided. How do you manage PCOS? First and foremost is to practice good sleep hygiene. We all know that sleep is very important and it affects the stress level and help to balance the hormones. Upgrade the sleep hygiene. Aim is to have 6 to 8 hours of sound sleep each night. You have to establish a regular bedtime routine. Avoid stimulants like coffee, tea, etc. and fatty foods before bedtime, and avoid the electronic gadgets before bedtime. To reduce stress, you have to do meditation, take a nap, cut down on your coffee, tea, listen to music, light exercises to reduce stress levels, and play with the pets. Taking walk outside or running and creating a space in life for relaxation and self-care, and this will reduce the stress levels in a case of PCOS. You have to balance your exercise. Exercise is important for maintaining a healthy weight, but too much exercise can disrupt the hormones. Gentle, low-impact exercises like yoga and pilates can be practiced for longer durations. Swimming and light aerobics are also recommended. High-intensity intervals and long-distance runnings may help improve symptoms of PCOS. Yoga in PCOS is very important, and yoga poses like bow pose, butterfly pose, Superman pose, churning pose, and all other forms of yoga are important for PCOS. You have to handle the psychological distress for these diseases. The psychological distress due to obesity, acne, excessive hair, as well as infertility and long-term health-related concerns comprise quality of life, and it adversely impact upon your mood. So you have to have a balanced diet, you have to sleep well, you have to do regular exercises. This will help to come out of the psychological distress for this disease. So do not worry, have a smile. PCOS can be managed. You have to do regular visits with your gynecologist, and you do not take your medications of your own, and do not stop your medications of your own in between your treatment cycles. So this is a PCOS awareness initiative, and I thank you all for your patient hearing.